Did you know that by the time you finish watching this video, approximately 20 seniors will have received a devastating dementia diagnosis? That's one person every 66 seconds. But here's what should really terrify you. What if the root cause isn't getting older? What if it's sitting right there in your medicine cabinet? You've been reassured these pills are safe, routine, even necessary for your health. But groundbreaking new research is raising serious red flags. 99% of seniors have absolutely no idea that at least one medication they're taking every single day could be shrinking critical memory centers in their brain by more than 28% in less than 12 months. Let that sink in for a moment. I know this sounds scary. I am Dr. Robert Casey. And let me tell you something. I've seen it happen too many times in my practice. People trust their medications completely. In fact, a 2023 study published in Neurology and Aging Research discovered that one particular class of medications increased dementia risk by 49% in seniors within just 2 years of regular use. That's not a small increase. That's nearly half again the normal risk. In this video, I'm going to reveal the 8 most dangerous medications triggering rapid memory loss and dementia, ranked from the most commonly prescribed all the way down to the one that is quietly destroying the most minds in America today. And number 3 on this list is prescribed to millions of seniors for something that seems completely harmless, but it can shrink key memory centers in your brain, and you probably don't even realize it's happening right now. Before we dive into this crucial information, I want to hear from you. Drop a comment right now and let us know, are you currently taking any daily prescription medications? And have you ever experienced sudden brain fog or unexplained forgetfulness after starting a new prescription? Type 1 in the comments if this video is already eye-opening for you, or type 2 if you already suspected something like this was going on. We read every single comment and reply with personalized insights based on your specific situation. And if you haven't already, please hit that subscribe button right now so you never miss critical information like this. Speaking up could literally save your mind. Now, without any further delay, let's start at number 8. And don't let its position fool you for even a second. This is the most widely prescribed medication category in the world, and it may be quietly robbing you of your cognitive health one daily dose at a time. Number 8. Statins, specifically simvastatin and atorvastatin. Statins are among the most widely prescribed drugs in the entire world, especially for people over 60. They're intended to lower cholesterol and reduce your risk of heart attacks and strokes. Simvastatin and atorvastatin, sold under the brand names Zocor and Lipitor, are the 2 most commonly prescribed versions. But here's where the serious problem begins, and almost nobody is talking about it. Cholesterol isn't just a heart health issue. It's an absolute brain necessity. Your brain is composed of nearly 60% fat, and cholesterol plays a critical role in creating and maintaining the myelin sheath, the protective coating that helps nerve signals travel smoothly and efficiently throughout your brain. When you aggressively lower cholesterol with powerful statin medications, you may also be starving your brain of exactly what it needs to function properly. And for millions of seniors enrolled in Medicare and managing multiple chronic conditions, this risk is compounded every single day. In a 2023 study published in Frontiers in Aging Neuroscience, researchers found that seniors over 70 who had been taking statins for more than 3 years straight had a 26% higher risk of mild cognitive impairment. Those taking high-dose statins showed even more alarming declines in mental function. What makes this even more frightening is that some patients, like a 72-year-old retired accountant named Barbara, reported sudden onset memory loss, describing terrifying moments where she couldn't recall familiar names, recent conversations she had just had, or driving routes she had traveled for years. Her doctor had never once mentioned this possibility. Now, it's important to understand that not all statins affect the brain equally. Medications like pravastatin and rosuvastatin do not cross the blood-brain barrier as easily and are considered significantly less risky in terms of cognitive side effects. If you've been on a statin for years and you're noticing mental fog, increasing forgetfulness, or growing confusion, it might be time to have a serious conversation with your doctor about a dose reduction or an alternative approach to managing your cholesterol. Don't wait until the damage becomes irreversible. The earlier you act, the better your chance of protecting your mind for all the years to come. Stay with me, because number 7 is something tens of millions of people take for anxiety and sleep, and the research surrounding long-term use in seniors is one of the most alarming things I've ever encountered in my practice. Number 7. Benzodiazepines. Benzodiazepines, which include commonly prescribed drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are some of the most widely prescribed medications in America for anxiety disorders and sleep problems. They work by enhancing GABA, your brain's natural calming chemical, reducing overstimulation and nervous system activity. At first, these medications seem like lifesavers. They quiet racing thoughts, ease panic attacks, and help you fall asleep at night. But over time, these drugs transform into something else entirely. They become a trap that's almost impossible to escape. A 2022 study published in the British Medical Journal followed over 8,000 seniors over a 6-year period and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk climbed even higher for long-acting benzos like diazepam, which remain in your body much longer and accumulate in fatty tissues, including your brain tissue. What happens is a kind of chemical sedation that progressively slows down neural activity throughout your brain. Your brain stops learning new information as efficiently as it should. It becomes less flexible, less adaptive, and increasingly prone to confusion, memory gaps, and emotional numbness. Seniors taking benzodiazepines regularly often describe feeling like they're moving through a constant fog, disconnected from their own lives, or just not feeling like themselves anymore. And when they try to stop, withdrawal symptoms including severe anxiety, agitation, and debilitating insomnia can be absolutely brutal, making the drug feel essential when it is actually the primary source of the problem. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly under any circumstances. This can be genuinely dangerous and even life-threatening. Instead, work closely with a knowledgeable physician to very gradually taper the dose over weeks or even months. Safer alternatives like buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy, specifically designed for insomnia and anxiety, can help restore calm without causing progressive memory loss. That is the kind of solution worth fighting for. Keep watching because number 6 is something you probably have in your home right now and have never once questioned. And that is exactly what makes it so dangerous. Number 6. Diphenhydramine, commonly sold as Benadryl. Diphenhydramine is that familiar pink pill millions of people trust to help them fall asleep, relieve seasonal allergies, or ease cold symptoms. It's inexpensive, available over the counter at any drugstore, and you probably have a bottle of it in your nightstand right this very moment. You may think you're simply taking it to sleep better or get relief from allergies, but inside your brain, Benadryl is actively disrupting your hippocampus, the specific region responsible for forming and storing new memories. Benadryl belongs to a family of drugs called anticholinergics, which work by blocking a crucial neurotransmitter called acetylcholine. This is the chemical messenger that helps your brain create new memories and maintain alertness throughout the day. As your brain ages, it becomes increasingly dependent on every bit of acetylcholine it can produce. And when medications like Benadryl interfere with that delicate process, the results can be absolutely devastating. According to a 2023 study published in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs on a regular basis had a 54% higher risk of developing dementia compared to those who avoided these medications entirely. That's more than half again the normal risk just from taking what most people consider a harmless sleep aid. To protect your cognitive health, avoid anything containing diphenhydramine, especially if the label says PM, nighttime, or allergy relief. These products are often just Benadryl hidden under a different name. If you're using diphenhydramine for allergies, there are much newer non-sedating options like loratadine, commonly sold as Claritin. These newer antihistamines do not cross the blood-brain barrier and are dramatically safer for long-term use in seniors. Never stop any medication abruptly without medical guidance, but also never assume that over-the-counter automatically means safe for your brain. If what I'm sharing right now concerns you even a little, please hit like so more people can find this information. It matters more than you might realize. Number 5. Paroxetine, sold as Paxil. Paroxetine, sold under the brand name Paxil, is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for depression and anxiety. At first glance, it appears to be a modern, sophisticated antidepressant, one that is supposed to be gentler and safer than older psychiatric drugs. But here is the critical part they rarely tell you about. Paroxetine is the only SSRI that has significant anticholinergic properties, meaning it interferes with acetylcholine in your brain. That single detail makes it fundamentally and dangerously different from its SSRI counterparts like sertraline or escitalopram. In a large 2021 comprehensive review published in Frontiers in Psychiatry, researchers examined the cognitive profiles of elderly patients taking different SSRI antidepressants. They found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within just the first 12 months of treatment. Seniors taking paroxetine were also 30% more likely to show early warning signs of cognitive impairment compared to those taking other common antidepressants. The cruel irony here is that paroxetine is often prescribed specifically to stabilize mood and reduce anxiety, yet it ends up systematically undermining mental clarity and emotional regulation over time, defeating its own stated purpose. The fix here is straightforward but essential for your long-term brain health. Avoid paroxetine entirely in seniors. The American Geriatric Society has officially placed paroxetine on its Beers criteria list, a carefully compiled list of medications that are potentially inappropriate for older adults due to serious safety concerns. If you're currently taking it, ask your physician about switching to much safer alternatives like sertraline or escitalopram, which are significantly better tolerated and don't carry the same serious cognitive risks. Supplementing with B vitamins, especially B12 and B6, can also support mood naturally and may reduce your overall need for antidepressant medications over time. Now we are entering the top 4. And what I'm about to share next is something that has genuinely disturbed me throughout my entire career in medicine. Number 4, amitriptyline, sold as Elavil. Amitriptyline, sold under the brand name Elavil, is an older antidepressant that is still surprisingly commonly prescribed today for chronic pain conditions, insomnia, and sometimes even migraine prevention. At first glance, it may seem like a versatile, multi-use pill that solves several problems at once. But underneath the surface, it is actually one of the most potent anticholinergic medications still in widespread circulation today. That means it powerfully blocks the action of acetylcholine, the chemical messenger that helps neurons communicate with each other, form new memories, and maintain mental sharpness. In fact, it blocks acetylcholine so strongly that cognitive effects aren't just possible side effects. They are essentially expected consequences with long-term use. In a massive 2015 study published in JAMA Internal Medicine, researchers carefully examined over 3,400 adults aged 65 and older. They discovered that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. That's not just a slight increase in risk. That's more than half again the normal risk of dementia. What's absolutely terrifying is that the vast majority of these patients were never told that this drug could actively harm their memory function. They were often prescribed amitriptyline for sleep problems or nerve pain, and then slowly started noticing troubling changes like short-term memory loss, word-finding difficulties, and increasingly foggy concentration. It doesn't even require a high dose to cause serious problems. Even low-dose amitriptyline taken nightly over several years can create a slow, invisible erosion of brain power that happens completely silently. The damage occurs without warning. No clear symptoms at first, just a gradual decline that looks exactly like normal aging, but is actually drug-induced cognitive impairment that could have been entirely prevented. So if you or a loved one is currently taking amitriptyline, speak with your physician immediately about safer alternatives. For nerve pain, options like duloxetine or gabapentin may offer equivalent relief without carrying the same level of severe anticholinergic burden. For sleep problems, melatonin or very low-dose doxepin, which has a much milder anticholinergic profile, can be used instead with far less risk. And for mood support, there are much newer antidepressants available like sertraline or escitalopram that are generally considered dramatically safer for long-term brain health. We are now down to the final 3, and these are the ones I urge you to pay the closest attention to. Number 3 is prescribed for something that affects the daily dignity and independence of millions of seniors, and almost no one is connecting it to the brain damage happening behind the scenes. Number 3. Bladder control medications, specifically oxybutynin. Oxybutynin, sold under the brand name Detropan, is frequently prescribed to seniors who struggle with urinary incontinence or overactive bladder. On the surface, it seems like a practical, compassionate solution. Nobody wants to live with the embarrassment or inconvenience of urgent bathroom trips throughout the day. But this medication works by blocking acetylcholine, the same critical brain chemical disrupted by Benadryl. And unlike some milder anticholinergic medications, oxybutynin crosses the blood-brain barrier very easily and directly affects memory regions in your hippocampus. That characteristic makes it particularly dangerous for seniors, especially when used over extended periods of time. In a comprehensive 2019 study published in the British Medical Journal, researchers discovered that people over 65 who took strong anticholinergic medications like oxybutynin for more than 1 full year had a 49% higher risk of developing dementia. That's nearly 1 in every 2 users. What makes this even more alarming is that the vast majority of seniors are never properly warned about these serious cognitive side effects. They're simply told the medication will help control their bladder, not that it may be silently accelerating mental decline with every single dose. The cognitive harm is often mistaken for normal aging. Seniors commonly describe feeling mentally foggy, forgetting important appointments, constantly misplacing everyday items, or suddenly struggling to follow simple conversations. The connection back to the medication is almost never made until significant damage has already occurred. If you're currently taking oxybutynin and you've noticed any mental changes at all, it's not just in your head, and you absolutely don't have to stay on this drug to maintain bladder control. Newer medications like mirabegron, sold as Mirabatriq, work through a completely different mechanism and have shown significantly less impact on memory function. These alternatives don't block acetylcholine at all and are generally considered much safer for older adults who need bladder support. Now we are down to the final two, and these are the ones I urge you to pay the closest attention to. Number 2, antipsychotics. This one is especially alarming because many seniors don't even realize they're taking an antipsychotic medication. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were originally developed to treat severe psychiatric conditions like schizophrenia and bipolar disorder. But today they're frequently prescribed off-label to elderly patients for common sleep problems, mild agitation, or behavioral changes associated with dementia itself. That's right. These are powerful drugs designed for serious psychiatric illness now being routinely administered in nursing homes and care facilities for seniors who are simply confused, restless, or difficult to manage by staff. The consequences of this are devastating. A 2022 study published in The Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within just 12 months, even if they had absolutely no prior history of dementia before starting the medication. Even worse, these drugs dramatically increase the risk of stroke, sudden cardiac death, and severe sedation, which can directly lead to falls, emergency hospitalization, or permanent institutionalization. The mechanism behind this damage is direct and brutal. These medications aggressively suppress dopamine, a chemical not only intimately linked to mood and motivation, but absolutely critical for executive function and memory processing in your brain. When dopamine levels crash, your brain becomes sluggish, slow, and unresponsive to stimulation. This is exactly why seniors taking antipsychotics often appear dull, emotionally flat, or completely vacant. Their personalities fade. Family members find themselves grieving for someone who is still physically present but mentally and emotionally unreachable. Think about that for a moment. A living person right there in the room and yet completely gone. Sometimes the cause is a drug that should never have been prescribed at all. Correcting this tragic situation starts with asking hard, direct questions. If you or a loved one is currently taking one of these medications, ask the prescribing physician exactly why it was prescribed and whether it is genuinely medically necessary. In the vast majority of cases, behavioral symptoms can be effectively managed with non-drug interventions, including structured daily routines, reduced environmental overstimulation, addressing underlying pain or discomfort, and improving lighting and sleep conditions. When medications are absolutely necessary, the lowest possible dose for the shortest possible period dramatically reduces harm. But more often than not, these drugs are being used out of convenience for staff, not genuine medical necessity for the patient. The real tragedy is that most families are never told what these drugs actually do to the brain. They simply watch their loved one declining without ever knowing the cause is chemical, not inevitable. And now we arrive at number 1. This is the hidden danger that almost nobody talks about. It isn't a single pill. It's something far more insidious, and there is a real chance it is already happening to you or someone you love right now without anyone realizing it. Number 1. Anticholinergic polypharmacy. This is the hidden danger that almost nobody discusses, and it is genuinely one of the biggest contributors to drug-induced dementia in the elderly population today. You may have been expecting a single specific drug to top this list, but the most dangerous medication situation for rapid dementia in seniors isn't one particular pill. It's the silent, creeping, cumulative effect of taking multiple medications with anticholinergic properties at the same time, a dangerous pattern that medical professionals call anticholinergic polypharmacy. Here is what makes this even more chilling. Many of these seniors receive routine prescription reviews through their Medicare coverage, yet the cumulative anticholinergic burden is almost never assessed or discussed. The healthcare system is structured to treat individual conditions in isolation, not to examine the compound neurological damage caused by multiple drugs interacting on an aging brain. That systemic blind spot is silently costing people their memories, their independence, and their sense of self. It is one of the most urgent and underreported crises in senior health today, and it will not improve until patients and families start asking the right questions. This isn't just a theoretical concern. A 2022 analysis published in Age and Aging tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That is more than double the normal risk. And the vast majority of these seniors had absolutely no idea they were even taking anticholinergic medications. Nobody had ever explained it to them. When you block acetylcholine from multiple directions simultaneously, your brain doesn't just slow down temporarily. It begins to actively deteriorate. Neurons physically wither from chronic underuse. Synapses shrink and disappear. And your brain enters a hypoactive state that looks nearly identical to Alzheimer's disease on cognitive testing. But here's the most empowering thing I can tell you. Correcting this dangerous situation doesn't require a miracle cure or an expensive treatment plan. It simply requires a thorough, comprehensive medication review. Ask your doctor or pharmacist to carefully evaluate your complete list of prescription medications, over-the-counter drugs, and even supplements for their anticholinergic load. There are online tools and professional software programs that can calculate your cumulative anticholinergic burden score with your full medication list. Once the problematic medications are identified, you can work systematically to deprescribe safely, tapering off unnecessary drugs, switching to safer alternatives wherever possible, and allowing your brain chemistry to rebalance naturally. Drug-induced dementia is very often reversible when caught early enough. When the medication burden is lifted and removed, many seniors dramatically regain mental clarity, physical energy, and memory function within just weeks or months of stopping the problematic drugs. Your brain is remarkably resilient and capable of healing, but only if you give it a real chance by removing what is harming it. Polypharmacy isn't just dangerous, it is completely preventable. And that makes it the single greatest hidden medical threat to the minds of our entire aging population. Now I want to hear directly from you. Which of these 8 medications are you currently taking? Have you noticed any troubling brain fog, increasing forgetfulness, or personality changes since starting a new prescription? Type 1 in the comments right now if this video changed the way you think about the medications in your cabinet, or type 2 if you already knew something was wrong. And if you haven't subscribed yet, please do it right now. I share critical information like this every single week, and what I have coming next could be just as important as everything you heard today. Thanks for watching. I'm Dr. Robert Casey, and I'm here to help you stay sharp, healthy, and strong for all the years ahead.